The relationship between iron status and menstrual health, a health education video. To start with, let me ask you a question. Do you think there is a relationship between iron status and menstrual health? The answer is yes. There is a strong relationship between iron status and menstrual health. The iron status has an impact on the menstrual health and vice versa. Maintaining the iron status is of utmost importance in women of reproductive age. Did you know? It has been reported that 3 to 24 mg of iron is lost during each menstrual cycle. Before moving on to the topic in detail, let me give you a brief introduction about the role of iron in blood. The major component of blood is red blood cell. Each red blood cell is made up of several hundred hemoglobin molecules. Iron is the most essential component for the formation of hemoglobin. Hence, lack of iron in the body can affect the formation of blood. Now we will look into the relationship between iron status and menstrual health. Iron deficiency anemia and menstruation have a two-way link. People who get heavy periods are said to have a higher risk of getting iron deficiency, whereas women who have iron deficiency are said to have complications in their menstrual cycle. Two major mechanisms by which the iron status of the body is affected. The mechanism 1. Since women lose blood during their menstruation, they are also likely to use iron content from their body. This can increase the risk of iron deficiencies or iron deficiency anemia in women. However, just because women bleed once a month does not mean it always leads to a deficiency. This happens only when the lost iron is not replaced with more iron consumed in the diet. Iron deficiency is also common during pregnancy due to the high requirement of the nutrient in the body. Mechanism 2. Heavy bleeding during menstruation leads to the extra loss of iron from the body. Prolonged heavy bleeding leads to anemia. When you lose a lot of blood during a period, one may end up losing more red blood cells than the body can make. This can reduce the amount of iron in your body. As a result, the body will have a harder time making the hemoglobin that is needed to carry oxygen in the blood. Impact of low iron status on menstrual health. Premenstrual syndrome, that is the physical and emotional symptoms which occur in women of reproductive age before the onset of menstruation, is found to be associated with the iron status. Certain menstrual irregularities like infrequent menstrual periods, excessive or frequent menstruation or heavy frequent periods, and no menses were also found to be associated with iron status and is found to cause anemia. The symptoms caused during menstrual cycle which is associated with iron status are fatigue, period pain, nausea or vomiting, constipation or diarrhea, headaches, backaches, appetite changes or food cravings, mood swing, bloating and breast tenderness. As far as the link between iron deficiency and period pain or other menstruation related abnormalities is concerned, women who do not consume enough iron through their diet face all these symptoms during their periods. All these points contribute to the importance of maintaining iron status for achieving menstrual health. Hence, it is very important to add iron-rich foods to the diet. In general, a proper, well-balanced diet containing all the food groups like cereals and millets, pulses, fruits and vegetables, dairy products, nuts and oil seeds, along with fiber and good hydration, can help us to achieve the requirements of all nutrients. Concluding points. It is therefore crucial to provide your body with iron-rich foods throughout the month, especially during the 3 to 5 days when you bleed, in order to replenish the lost nutrients in the body. I conclude this video by sharing a quote by Michelle Obama. Communities, countries, and ultimately the world are only as strong as the health of their women. Thank you for watching this video.